New Deep Dive.
Welcome to the Deep Dive. Today, we're jumping into a really fascinating area, stem cell therapies for our pets, our companion animals.
It's a field that's moving incredibly fast.
Absolutely. And we've been digging through recent articles, research papers, company notes, basically trying to get a clear picture of how these treatments are evolving, what they really mean for pet health, for your pets, and also the journey, the rigorous process to actually make them widely available.
And there's a lot of excitement, particularly around these newer, ready-to-use options.
Exactly. That's a key part of this. And, the momentum is clear. We saw companies like Gallant Therapeutics securing a big $15 million Series A funding round recently.
Right, that's significant investment.
It really is. And it's fueling development for these next-gen treatments. And we're not just talking about rare diseases here.
No, these are targeting really common chronic problems, things like osteoarthritis, kidney disease, even skin issues like atopic dermatitis in dogs and cats.
Okay, so let's unpack this then. What exactly makes these therapies ready to use? What does that mean, sort of practically, for pet owners and vets?
Yeah, that's really the core question, isn't it? It gets down to a fundamental shift, moving between two main types of cell therapy, autologous and allogeneic.
Right. Autologous and allogeneic.
Exactly. So autologous, think auto, self, uses the patient's own cells. You collect them from the animal, process them, maybe grow them, and then put them back into the same animal.
Okay, and the upside there is?
The big advantage is no immune rejection. The body recognizes its own cells, so they tend to survive, multiply easily. It's a familiar environment for them.
Makes sense. But there must be downsides too.
There are limitations. You have to do that whole processing individually for every single patient. That takes time, it costs more.
Right. Not very scalable.
Not at all. And there's another consideration. If the animal's own tissues might be diseased, you could potentially be transferring compromised cells. It's something to think about.
Okay, so that's autologous. What about the other one? Allogeneic.
Allogeneic is where the cells come from a donor, a different animal, not the patient.
Ah.
And this is what enables that off-the-shelf readiness we mentioned. You can take cells from one healthy donor, expand them, and create potentially hundreds or thousands of doses.
Wow. So one donation treats many animals.
Precisely. That means standardized production, much greater scalability, and ultimately wider availability and potentially lower cost. It's a game changer for access.
That sounds like a huge advantage. Is there a catch? You mentioned immune rejection earlier for autologous. Is that a risk here?
It is the main potential limitation, yes.
Yeah.
The recipient's immune system might see the donor cells as foreign and attack them, but researchers are developing ways to manage or reduce this risk using specific cell types or pre-treatment strategies.
Okay, so here's where it gets really interesting. Like you said, this shift, this move in veterinary medicine towards these ready-to-use allogeneic therapies, it feels like a major step.
It absolutely is. It could make these powerful regenerative treatments far more accessible for pets suffering from those chronic conditions we talked about.
But, getting these amazing treatments from the lab bench to the local vet clinic, that's not just about the science, is it? There's a whole regulatory piece here. How does the FDA make sure these things are actually safe and effective?
You're right. The regulatory oversight is absolutely crucial. In the U.S., it's the FDA's Center for Veterinary Medicine, the CVM, that handles this.
The CVM, okay.
They classify these as animal cells, tissues, and cell and tissue-based products, ACTPs for short.
ACTPs, got it.
And the approval process is, well, it's rigorous. Companies or sponsors have to submit a lot of data. We're talking laboratory studies, clinical trials, field studies.
To prove what exactly?
3 key things, namely safety, effectiveness, does it actually work? And consistent manufacturing quality. Can they make the product reliably batch after batch?
That sounds pretty thorough.
It is. And there's something else important for pet owners to know about: conditional approval.
Conditional approval, what's that?
It's a pathway the FDA offers. If a company can show the product is safe, manufactured properly, and has a, quote, reasonable expectation of effectiveness.
Reasonable expectation. Meaning it looks promising, but maybe doesn't have all the long-term data yet.
Exactly. It allows promising therapies to get to animals sooner, potentially filling an unmet need, while the company continues collecting that full effectiveness data over the next 5 years.
Ah, I see. So it speeds things up a bit.
It can. For example, Gallant, the company you mentioned earlier, they're apparently aiming for potential conditional approval for a cat condition, feline chronic gingivostomatitis, or FCGS, by maybe early 2026.
Okay, FCGS. We should definitely talk more about that. But just to be crystal clear for everyone listening right now as we record this, have any stem cell therapies received full FDA approval for vet use?
That's a key point. No, not yet. No full approvals. But several are definitely in the pipeline, undergoing those FDA-compliant clinical trials.
Right. Like we know Cornell University got FDA authorization for research into musculoskeletal and neurological issues in dogs and horses.
And Vet Cell Therapeutics, they're running FDA-compliant trials for that very condition, FCGS, the feline mouth inflammation.
So the work is happening. It's just a long process.
It is, and it needs to be. If you connect this to the bigger picture, the FDA's careful, diligent approach is vital. It ensures that when these innovative treatments do become available, vets and pet owners can trust they are both safe and genuinely effective.
That makes sense. Public trust is key.
Absolutely. And the FDA actually provides resources to help developers navigate this. They have guidance documents, something called the Veterinary Innovation Program, or VIP, to help streamline things for novel therapies.
VIP, okay.
And they even keep a public list of ongoing clinical trials. So, if you're a pet owner whose animal has a condition being studied, you could potentially look into enrolling them.
That's really good to know. Okay, so let's pivot from the regulations to a specific example where this is showing real promise. You mentioned feline chronic gingivostomatitis, FCGS. Tell us about that.
Right, FCGS. It's a truly awful condition for cats. It's this severe, persistent inflammation in the mouth, gums, back of the throat.
Painful, I imagine.
Extremely painful. And frustratingly, it often continues even after vets have tried removing all the cat's teeth, which is usually a last resort for dental issues.
Wow, even after full mouth extraction.
Yes. We call those cases refractory FCGS. They just don't respond to standard treatments. And for those poor cats, stem cell therapy has emerged as, well, a potential lifeline.
How does it work in this case?
Research, notably from UC Davis, has shown significant success using mesenchymal stem cells, or MSCs. These are often derived from fat tissue, adipose tissue.
Okay, fat-derived MSCs. And what do they do with them?
They administered them intravenously, so into the bloodstream. And in one key study, 5 out of 7 cats with that really tough refractory FCGS showed either complete clinical remission or very significant improvement.
5 out of 7. That's pretty remarkable for a condition with few options.
It really is. It offers genuine hope.
So what are the stem cells actually doing in the cat's body? Is it just about healing the tissue?
It seems to be more complex than just tissue repair. The evidence suggests it's actually modulating or rebalancing the cat's immune system.
Ah, so it's tackling the underlying inflammation cause.
That appears to be the case. Cats that responded well showed a decrease in certain types of aggressive immune cells, like CD8 plus lymphocytes, and also lower levels of inflammatory markers systemically throughout their body.
So it's calming down that overactive immune response.
Exactly.
Yeah.
It's not just patching the damage, it's trying to fix the root cause of the inflammation.
And you mentioned the success rates. Are they generally holding up in other studies too?
Yes, the reports are encouraging. Different studies, maybe using slightly different types of MSCs or protocols, show response rates varying, but generally in the range of, say, 57% up to maybe 83%.
It's a solid range, especially for refractory cases. What does the treatment typically involve for the cat?
The most common protocol studied involves 2 IV injections, usually given about a month apart.
Okay. Is the improvement immediate?
Often not. That's an important thing for owners to understand. The clinical response can be delayed. You might not see significant changes for maybe 2 to 4 months after the first injection.
So it takes time for the immune modulation to kick in.
It seems so. The cells need time to exert their effects and for the body to respond and heal. Patience is key.
Are there newer approaches being looked at too?
Yes, researchers are exploring other things. For instance, instead of whole cells, using just the beneficial factors secreted by the cells, what's called the secretome.
The secretome?
Yeah.
Like the healing juice from the cells?
Kind of, yes. The mix of proteins and molecules they release, and maybe delivering that via injections directly into the inflamed mouth tissues rather than IV.
Interesting. More targeted.
Potentially. And there's also thought about using stem cells earlier in the disease process, perhaps before resorting to full mouth extraction, to see if it can prevent the condition becoming so severe and refractory in the first place.
That makes a lot of sense. So really what this boils down to for FCGS, this experimental therapy, is basically the only known effective option for many of these cats when everything else has failed, right?
For the truly refractory cases, yes. It represents a significant beacon of hope for cats that would otherwise face ongoing pain and potentially euthanasia.
It really highlights the potential impact of these therapies.
Okay, so we've covered quite a bit today in this deep dive.
We have.
We looked at the really exciting shift towards these ready-to-use or off-the-shelf allogeneic stem cell therapies.
Moving beyond the individual patient model. Right. And the crucial role of the FDA, the CVM, in ensuring these treatments are safe and effective through that rigorous approval pathway, including conditional approval.
Absolutely vital for trust and responsible innovation.
And then we saw a concrete example, the success in treating that awful feline gingivostomatitis, FCGS, offering real hope where there often wasn't any.
Which really brings the potential to life. And, this raises an important question as we look ahead.
Yeah.
As these kinds of advanced regenerative therapies continue to develop and hopefully gain approvals, what other conditions do you think will be next? What are the next frontiers for benefiting from this, and how might this really change the landscape of veterinary care more broadly?
That's a great question to leave everyone thinking about. What is next? It's certainly a space to watch. Thank you for joining us for this deep dive into the future of pet health. We definitely encourage you to keep following this rapidly advancing field.
Subscribe. New Deep Dive.